Good evening. We're glad you're with us tonight. I'm Shannon Ogden.
And I'm Jessica Porter in for Andrew Hio. The first U.S. case of a more contagious strain of the coronavirus has been detected in the worst possible place, a nursing home.
Colorado's top doc, Rachel Herlihy, revealed today the first person to test positive is a member of the National Guard. He was helping with an outbreak at the Good Samaritan Society assisted living facility in Simla. And a second member of the Guard is also suspected to have it.
Adi Guajardo will join us from Elbert County with more on that in a moment. But we begin this evening with Tony Kovaleski on the state's response and what the strain's arrival means for our state. Tony.
In many ways, Jessica, it's a game changer. The news comes at a time when vaccines are arriving and more Colorado residents are qualifying for that vaccine. Now, this new strain brings more questions and concern.
Early evidence seems to show from the United Kingdom that this particular mutation might spread more quickly.
Governor Jared Polis describing what epidemiologists currently know about the COVID-19 variant identified as B.1.1.7.
This is unlikely to be the first person with the variant here in the United States, but I'm proud that we detected it here in Colorado as quickly as we did.
In fact, Colorado State Labs were the first in the country to identify the variant. It's a mutation that's believed to have originated in the UK, identified there back in September. We now know it's in Colorado, but we still don't know specifically where it came from or how it got here.
The worry, of course, is that if it's spreading faster and more people have it, even with just the regular rates of hospitalizations, this could be overwhelming for our healthcare systems.
In the UK, the new variant forced a shutdown 12 days ago. More than 40 countries responded by banning travel from that country. The United States did not ban travel, but did require a negative COVID test for all UK travelers. Since the discovery in Colorado on Tuesday, state investigators are actively tracing the variant's roadmap to Colorado.
We have an extensive investigation underway to identify all contacts the cases may have had in the 2 weeks leading up to their deployment.
Some reports say the new strain is up to 70% more contagious, but experts currently believe it's not more severe and may not change the success rate of the current vaccine.
The other thing we're hearing, of course, is that this variant of COVID doesn't seem to be more deadly. It appears that this vaccine, we estimate, will be just as effective for the new variant as it was with the old.
This new variant is just another reminder that there is a lot that we don't know about the virus, but there's also a lot we do know, namely how you can avoid getting it and increase your chances of not contracting the virus.
So you might be asking, why was Colorado the first to locate this new strain? According to the state lab, scientists there used advanced molecular detection techniques to discover the B.1.1.7 strain. Governor Polis saying he's expecting similar announcements soon from other states. Shannon?
And news tonight from California. The new strain is there as well. Tony, thanks for that. Adi Guajardo and Simla tonight. And Adi, for those who aren't familiar, it's a very small town, about 640 people. And I'm guessing they're all talking about this tonight.
Shannon, they are. People we spoke with say they're scared of the COVID-19 variant because this is a small town home to an older population. At least 2 locals we spoke with that didn't want to go on camera tell us many residents here haven't taken the necessary safety precautions like wearing a mask until most recently. Now, the assisted living facility, they're not allowing any visitors until further notice. Now, we did witness a delivery, and I just confirmed they're testing supplies. In the small town of Simla, with a population of less than 1,000 people.
The Colorado State Lab confirmed the first variant of COVID-19.
The Good Samaritan Society garnered national attention.
Of all places, it had to be Simla.
2 Colorado National Guard members assisting with staff shortages at the assisted living facility are currently in isolation. One tested positive for the COVID-19 variant known as B.1.1.7, and the second is a highly suspicious case. Both were deployed on December 23rd and tested on December 24th. Colorado is the first state in the U.S. to report the variant, which was first discovered in the UK.
Investigation underway to identify all contacts the cases may have had in the 2 weeks leading up to their deployment, as well as any other contacts outside of the facility they may have had during their deployment.
Colorado is the first state in the U.S. to report the variant, which was first discovered in the UK. Healthcare officials say B117 is more contagious.
If you're ill, instead of only making 2 or 3 other people sick, you might actually spread it to 4 or 5 people if it's more transmissible. Of course, with more cases come more hospitalizations, more ICU beds being filled.
A COVID-19 outbreak at the assisted living facility was reported in mid-December. Testing found 20 of 34 staff members tested positive for COVID-19 and 26 of 26 residents. So far, 4 deaths have been reported at the facility. A statement from a spokesperson with Good Samaritan Society reads that the state health department is currently testing residents for the variant and expecting results in the next few days. A healthcare worker who lives in town asked to remain anonymous. She tells us she's worried about her community.
So now that it's here, it's scary. Who knows who they came in contact with.
With few places to grab a bite and buy groceries, her fears are met with countless questions.
How did it get here and how long has it been here?
Now, health care officials say early results for that variant have come back negative, but they will continue to do testing. Reporting live in Simla, Addie Guajardo, Denver 7.